Hongkongers will be encouraged to detect diseases early and improve their lifestyle under the government's new primary healthcare blueprint. People will receive subsidies for checkups and more public health centers will be built, Macy Mark reports.
Under a fast-aging population, the government estimated 3 million Hongkongers will suffer from chronic diseases in the coming decade, up from the current 2.2 million. To alleviate pressure on public health care, authorities announced a primary healthcare blueprint with one central aim.
Primary healthcare focuses on prevention and early detection and diagnosis, especially using chronic diseases such as hypertension and diabetes as an example. If you can detect and diagnose these two conditions early, you will be able to avoid complications rather than waiting until complication happens and we'll have to go to all the specialists and even tertiary care. In that sense, that will help us in the long run, not just to improve our people's health, save life, but also to save money in our overall public healthcare expenditure.
Under a chronic disease co-care scheme, high-risk groups or those aged 45 or above will receive subsidies for private consultations to check for hypertension and diabetes. The 3-year pilot scheme could be launched as soon as the second quarter of next year. Undersecretary for Health Libby Lee said to enjoy the scheme, people can simply visit a private doctor listed on the government's primary healthcare register. Private doctors wishing to go on the list will have to receive additional training beforehand. The government hopes to expand the concept of family doctor as there are now only 2,600 doctors on the list, out of 15,000 practicing in the city. More district health centers will also be built in the coming years, as they will form the backbone of the prevention-oriented strategy. The public will be able to consult nutritionists and dentists to improve their lifestyle habits. Macy Mark, HKIBC.
Medical sector lawmaker David Lam welcomed the plan, but felt authorities should do more on rehab services.
What we should be doing better is the communication between the primary healthcare system and the hospitals. Emphasis has to be put on how to offload hospitals in two ways. One, those who are already seeing specialists in the public hospitals, but who are stable, who have to be diverted back to the community. And two, those who are admitted to the public hospitals, say for stroke or for cancer surgery. These patients should be discharged relatively earlier so that they go back to the community and receive rehabilitation and further treatment in the community.